to be here. I'm so excited. I'm Dr. Fleytman-Pope. I'm with Health, and you are?
I'm Orman. I am a radiation oncologist and lifestyle medicine specialist and chief wellness officer of that Medical Group. I practice here, actually, in Celebration, Florida, and I treat primarily breast cancer patients.
And I'm in longevity space, and we're a telehealth platform, so we treat everyone everywhere. So we're talking about breast health today. And since you are a cancer specialist, now we know that there is a rise of cancer in women under the age of 50. Why do you think that is?
So we actually just got some data out recently, and it showed, and it got a lot of press actually, that cancers are increasing in people under 50. And you probably saw that come out. And they mentioned gastrointestinal cancers more in the media, at least that's kind of what I saw. And gastrointestinal cancers are the most rapidly rising in people under 50, but the predominant piece of that increase in people under 50 was female breast cancer. And we know a lot about breast cancer, and then there's a lot we don't know. The things that we know are very heavily tied to an increased risk of breast cancer are 4 big things, maybe even 5. The food. And so when we are not eating enough plants, basically, that will increase our risk of breast cancer. Your physical activity, both cardiovascular and strength training. So we want to make sure we're getting 30 minutes minimum per day, something that kind of makes you sweat and even more cardio, and 2-3 days a week strength training. Body weight matters. So especially when we're talking about postmenopausal women, if we're carrying around extra body weight, those individual adipose cells, they are very metabolically active. What I mean by that is that they are pumping out inflammatory molecules all the time, wreaking havoc all over your body. And the other 2 big things tied to breast and other cancers, of course, alcohol and tobacco. So, and we'll talk a little more about alcohol later on, but there's no safe amount. And any amount increases your risk of breast cancer or breast cancer recurrence. And so those are the areas where we have the most data. Now, we have data in other areas like the effect of even childhood trauma, toxic relationships, poor sleep, stress in general. I mean, that's a huge category, and a lot of things feeding into it. But we know that these things are all related. But when we're talking about kind of the big factors, food, movement, alcohol, tobacco, body weight.
Yeah, and I'd like to touch on the food aspect. We do see, being in the longevity space, we do see that insulin resistance is huge, and it's such a big problem in America, and that is what's causing chronic disease. I mean, we're in an epidemic at this point of chronic disease state, and chronic disease is cancer as well. It's not just your diabetes, high blood pressure. So, women's health is greatly affected by that. 60% of America is insulin resistance, essentially. So that's part of the chronic disease. And why do you think that is? Why do you think chronic disease is such a big issue? What is one thing that you would pick out?
So I always try to simplify things in my mind. That helps me, and I think it helps, explain it to people in a way that they can really apply in their life. And so when I think about chronic disease, meaning all of it, heart disease, cancer, chronic kidney disease, Alzheimer's, diabetes, all of these things that are really our top causes of death in this country, they're all related to inflammation in the body. It's just a manifestation of inflammation. And so every little decision we make in the day gets us closer to inflammation or further away from inflammation. And that's how I personally kind of run my life. When I'm thinking about, do I want to have that cookie? Yeah, it's going to taste good for 3 minutes, but it's going to get me closer to inflammation. So decisions like that kind of go through that algorithm in my mind automatically now, and that's how I decide what I want to do. For example, this morning, I had a half marathon on my schedule, and I thought, I should really go sit in that room all day. And I thought, you know what, I need that run. So I ran my half marathon.
She's a badass, you guys. She literally got here 15 minutes ago, showered, and she's here. So
and I feel great, and I know that even though I would have loved to have spent a couple hours here, I was running in the woods on a trail, and it really did me good. And so everything in my life is kind of goes back to that. And so when we're thinking about what drives inflammation, it's the way that we live. And it is everything we do, everything we're exposed to, people in our life. And so, the food is very tangible, your exercise is tangible, your sleep. Then we get to stress. What plays into stress in your life? It's individual for each of us. It can be relationships in your life. It can be the poor sleep. It can be a lack of exercise. All of these things can cause stress and alleviate stress when they're going well. And so we have an inflammation issue in this country. And there's actually a really amazing publication that comes out periodically from the Journal of the American Medical Association, JAMA. And it shows for a big period of time what is the number one risk factor for death, and of course it shows the rest of them. But consistently, the number one risk factor for death in this country is dietary risks. What does that mean? Like the food is killing us. Dietary risks rank above tobacco in terms of danger. And so we really have to start thinking about food is not just calories in, calories out. Food is our health. And we have to do it every day. We have to be faced with these decisions every day. And so that's one of the most powerful things you can do for your health is to think about your relationship with food, how you're using it, because it's very complex. We have cultural things, we have things we've always done in the family, we have addictions, we have emotions involved. And it's something that we can't just abstain from. If you have an issue with alcohol, you can work on that and just abstain. You don't have a recommended daily requirement of alcohol. You have to eat, right? And so how do we rewire our thinking around the things that are the riskiest things that we do every day? And food is at the top of the list.
How many diseases or cancers do you think we can prevent by just lifestyle changes?
So it's really profound. We could prevent 80% of all heart disease, stroke, and type 2 diabetes, and 40% of all cancers across the board with changes in the way that we eat and the way that we live. And keep in mind, our top 2 causes of death in this country are heart disease, and then a close second is cancer. And most of my breast cancer patients, they actually die of heart disease.
So do we have any guidelines for cancer prevention?
Yes. So we have amazing guidelines, and we're actually on the 3rd version of them. The American Institute of Cancer Research, or the NCCN, you might have seen these things. They put out guidelines, American Cancer Society, all of these, any big disease, there's heart disease guidelines, there's diabetes guidelines, they all say a similar thing. And it's strange because it's in opposition to the way that our society runs. You drive in and there's billboards for McDonald's and all the commercials are, processed horrible food, and you go in the store and what's in your face first, it's like the snack foods. And so we have these guidelines and they're not like a new thing. And they basically say eat a plant-predominant diet, limit processed foods, limit sugar-sweetened drinks, eliminate red or processed meats. So another thing that's very surprising is the bacon, which is so tasty. I used to eat it too. Bacon is tasty. Sausage, that Easter ham, all of the deli meats and these things. These are processed meats. They're salted, cured, preserved. They're class 1 carcinogens, which means they are directly cancer-causing, and they're in the same category as alcohol and cyanide and asbestos, tobacco. And we can just buy them in Publix. So there's something wrong with that. The guidelines also say maintain a healthy body weight, get adequate exercise, avoid alcohol, avoid tobacco. You know, there are all of these things that we know are healthy behaviors, but there's actually really good data behind them in terms of the profound impact that they have on the way we feel, the length of our life, and the quality of our life. You know, and I think we can all agree we want quality, but we don't understand always that those little tiny, seemingly minuscule decisions we make every day have consequences 20 years down the road. And so, it's not an easy thing, you know. It is a complete rewiring of our thinking. We have kind of been in society told calories in, calories out, doesn't matter, like, that's not true. It's not true. If I eat 100 calories of French fries or 100 calories of kale, do you think it has the same effect on my body? No.
How many people do adhere to these guidelines? It's hard, right, guys? It's hard. How many do actually adhere?
Yeah, and it's pretty sad. So when we are talking about the cancer prevention guidelines, so the other thing I didn't mention is the cancer prevention guidelines to like prevent cancer in the first place are the same as the guidelines for survivors. And a survivor is anybody after that moment of diagnosis, means that you're surviving with cancer. That's what a cancer survivor is. It's not somebody that's like completed their treatment, which is kind of what a lot of us assume the official definition is that after diagnosis you're a survivor. We actually recommend the same guidelines for survivors as we do for people without cancer wanting to prevent cancer. Because it's all the same process. We've got to lower inflammation to get your body back to the place where it's not inhabitable for cancer cells. And so we did this study looking at cancer survivors, people with a diagnosis, how many of them follow some of the top guidelines. And it's 4%. It's 4%. And I'm not going to say that it is their fault or even the majority of their fault, because most of the time they don't know the guidelines exist. Because unfortunately, we as physicians aren't trained to deliver this sort of medicine. And so the education I got, the education Anna got, that largely didn't come from the traditional medical education system. I had 0 hours of nutrition training when I went to medical school. It's better now. I think you get about 11 hours of nutrition training. But I just told you, dietary risks are our #1 cause of death. And we're giving our doctors 11 hours of nutrition training. So there's a problem with that. And so when you are receiving care from your physicians, ask these questions and know that there are sources online, but there are more and more physicians now trained in this. And you can look for longevity experts, you can look for lifestyle medicine physicians. That's what I am. So I'm board certified in what's called lifestyle medicine. And that is basically how can we treat, prevent, and reverse disease with the way that we eat, the way that we live, all of these aspects of our life.
Yeah, and one thing to mention, the elephant in the room is alcohol, guys. So historically, in med school, we were told that 1 to 2 drinks, depending on male, female, it was okay. It was actually good for you, good for your heart. But we know more and more how dangerous it is. Like alcohol literally converts into a toxin. Acetaldehyde is a toxin to our DNA. It produces all kinds of radical changes within our body, and it's a huge burden to the liver that's already getting so much toxins from the the environment that we are in this, this day and age. So when you think about alcohol, think how toxic it is. And there's more and more research on breast cancer. And for every drink of alcohol per week, especially in the menopausal state, you increase your risk by like 9 to 11% of getting breast cancer. So that's huge. I mean, that's something that is hopefully easy for most to just take out of, their routine completely. It's really not good for you. So then there's this thing like, okay, resveratrol, right? That's the polyphenol that everyone talks about. That's like the anti-aging polyphenol. When we look at the studies, it's pretty humorous because they did those studies on rats. And the amount of resveratrol that they gave them literally equates to like gallons of wine for us. I mean, that's not sustainable, realistic, and I mean, it's just not good for you.
And that's how most studies are run.
Yes.
We start in animals.
Yes.
We are not rats or monkeys or pigs or dogs. And most of those studies done in the animals don't translate to the same results in humans.
Right.
And I think it's like 80% of them don't.
Yeah.
So when we're reading, the clickbaity things online that you'll see on the news or on social media, if you don't go back to the original study and see was it even done in humans, you may make a decision based on that study, and it doesn't even apply. We're not even sure.
So just say no to alcohol. You can eat blueberries, blackberries, you can get resveratrol that way, you can take a supplement, like whatever you need to do, just do not drink. I mean, aside from, your breast health, it's your liver, your brain, I mean, everything. It just wreaks havoc on your body like crazy. And then one more thing that we also, and I know you and I have discussed this, you talk to your patients about this, is mind-body medicine. There's a lot of studies out there on social relationships and mind-body health and survivorship with breast cancer. So that, the brighter outlook you have within, the stronger your mind is, the stronger the social ties that you have, just make it better for you. So when we, clean up our life, it's also cleaning up the toxic relationships that we have with other people and making sure that even if it's just that one person that's there for you, make that one person there for you and clean up the rest. So don't forget mind body. It's one thing that we really forget to talk to about with our patients. And like I said, you do speak on that with them.
Yeah, I do it in multiple ways with my patients. I have an 8-week program that they go through in groups. And I think that's the most powerful way to deliver this sort of medicine because you feel better when you're in a group doing something together. And how many self-help books do you all have on the shelves? It doesn't really work when you're just reading the book by yourself. So this sort of medicine really is more successful when we deliver it in groups so that we can create that support in the group. To also benefit from hearing other people's experiences because you don't feel so alone. These things are so common that we go through, but we still feel alone. Like I have 3 teenagers at home, and my daughter's in this horrible stage, and I feel so alone. And I keep telling everybody about it, and they're like, my daughter did it too! And like every time I hear that, I'm like, oh, okay. That's good. So we need to know that we're not alone, and that feeling of loneliness is deadly. It's like smoking 15 cigarettes a day. You can be lonely and still around people. It's the quality of the relationships that matter. Okay.
Thank you guys.